Howdy, everyone. Matt here. I got a question for you. Do you think someone who has a doctorate of physical therapy gets to use the title of doctor? Let's talk about it. All right, everyone. Let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video on another topic of something in the physical therapy world. And this one is something that I myself feel is the probably dumbest argument, conversation, debate, whatever that you want to say, that we have. And that is the use of the title of doctor. Okay. If you have the doctorate of physical therapy, people come out and start saying, you're not a real doctor. The other people say, no, we shouldn't use the doctorate. To me, I feel like this is the dumbest argument, debate. Like I said, the dumbest thing, mainly because it goes nowhere. And I just wanted to discuss it. And I hope maybe this is probably one of the last ones that we ever have about it. Now, going back, I just want to talk about this. That first and foremost, that I only see three types of people talk about this. There's two main ones. There's one, this little secondary one, but there's three types. The first type that are just trolls. It's just some random person that you as a physical therapist, and I'm just using the reference of physical therapist because PTs are the ones with the doctorate of physical therapy. But they post something on there online on social media platform, and some random person comes on there and goes, oh, you're not a real doctor. And they just throw this insult out. They don't contribute really anything to it. And I swear it's just like, say that there's like someone just like driving along whom you've never met or anything like that, and they just like stop and throw an insult at you and then just drive off. You're not a real doctor. Okay, that was weird. Kind of like that. It's like you're never going to see this person again. This person doesn't want to engage in a conversation or anything about it. And they just want to say that. They just want to throw that out there as just like a jab. And I think of those things when someone tries to insult in that way. This old proverb or saying, I cannot remember where it came from. They said, if somebody gives me a gift, if say someone comes to give me a gift and I don't accept the gift, whose gift is it? And that's how you try to throw an insult and I didn't accept it. So whose insult is it? Really? So there we go. So that's the first type. Second type. This is really the main one. It's a PT that is just looking for engagement because this thing is going to stimulate a discussion, a talk. It's just going to get a thing back and forth. And you're probably saying, well, Matt, aren't you doing that right now? Yes, I am. Yes, I am. And of course, if you like the video, hit the thumbs up if you do enjoy it. And also consider subscribing down below as well. But like I said, it's somebody that want engagement. And I've noticed it happens in this way. If somebody says it in a positive way, so to say, physical therapists, you should call yourselves doctors because you have the doctorate, you are experts in movement or rehab or what have you, they say, and all the comments under it are very positive for saying, yes, they're all positive, very few negative. But if it goes on the other side, where someone's like, no, PTs should not call themselves doctor, they should be reserved for somebody else, we don't have all this, then all of them are kind of lining up on that side, saying like, yeah, I agree, because again, if you're in either one of these crowds, especially in the negative one, we're saying that we shouldn't, and you say the opposite. So if you're in the negative group of saying, no, you shouldn't say, the person says, no, PTs shouldn't call themselves doctors. And you say, well, yes, they should. You're going to get attacked. So then it's like, well, I'm not even going to say anything. So everyone thinks like, oh, yeah. But I see that. It's like, you do this, people start talking and debating, and it doesn't go anywhere. And the third group is this small little group. They're medical providers. And it's just somebody, these kind of pop up here and there. It's somebody that they get on this like ego trip. Only MD should be called doctor. And they kind of start this little thing. And I never really see it going. And again, it just seems like they're just kind of speaking to their own crowd on that. But I did have a run-in with somebody, and I made a video about it a few months ago. A colleague of mine, she posted something. I cannot remember the exact video. And this physician assistant from whoever knows where went after her, saying that we laugh at PTs when they write doctor on it. You shouldn't be called doctor unless you're an MD or a DO. And it's pretty misogynistic how he was just kind of coming at this. And I commented on there. Said, hey, buddy, I had an English professor who was called doctor, and one of the hardest professors I had ever had in my undergrad, in my business classes, was doctor. He had a PhD, and he had a PhD in like human resources, and this guy worked extremely hard for his degree, and he had written a book that was a study guide for a huge exam that people all over the country or wherever utilize his book to study for this huge exam. And I said, well, these people we can call doctor. Heck, there was even a teacher in third grade that was doctor. Okay, it's like we can call them that doctor. And he kind of comes at me with something, and then he blocked me and deleted everything, blocked me, and ran off like a little wimp. But I pointed out as well, whenever medical providers start doing that stuff, to say, hey, you know what? We're all on the same team. Like, do you not see that we're all on the same team? Why are you trying to attack other people, other providers, when our ultimate goal is the patient is in the middle? That person, their care, their needs, we are trying to help that person in the middle, and that's what we should be focused on. Why are you coming at us? You can't do the stuff that we do. We can't do the stuff that you do. You can't do the stuff that other providers do. We're all on the same team, okay? We all ultimately need to work together to provide care to the public, okay? So, like I said, super small little group over there. So those are the three types of people that I see talk about this. And I want to talk about like how I feel about it, okay? I feel about it, okay? First and foremost, this is what I tell people, because this is something that comes up when people get in to start talking about the title of doctor. Is one, somebody's going to throw out, the doctorate was the worst thing we ever could have done. It's like, okay, first and foremost, we can't change it, okay? We can't. We can't. We cannot go back in time. I bring up, and again, I talked about that before. Can't bring. So I start talking about that. Do we need to get you a DeLorean so you can go back in time and change it? Okay, is that what you want? We can't change it. All right. And I will say as well, if you've watched Back to the Future, with that Back to the Future reference here, what would happen? You cannot say again. I'm sorry, got ahead of myself. We cannot say that the timeline would be the same. You're making a reference of saying that, the doctorate was the worst thing ever because you were looking at it through a hindsight. If we went back and changed it, would we be on the same trajectory that we are now? Would we be in the same place? Would the same things had fallen and do led us to here to say, yes, it's better? We can't say that. Again, you look at, go back to, was it Back to the Future 2 or no, I think it was the first one. Hey, we changed this and we caused an offshoot in the timeline. Yeah, you can cause an offshoot in the timeline, kind of getting into the Back to the Future thing. So we can't change the doctorate. We're probably not going to go back. We're not going to like regress it. So we have to deal with it. Okay, let's deal with it. All right. The other big thing that I point out, okay, for calling yourself doctor, is doctor is the designation of a degree awarded. That's what it is. It's not a profession. Again, my English teacher, my business teacher, they were not physicians. A physician is a profession. A surgeon is a profession. But again, They weren't physicians. They were, again, an English major and a business major. Okay. Again, or again, even all physicians the same. My dentist is doctor. My optometrist is doctor. My veterinarian is doctor. Okay, there's different areas of that. They all do different things. It's the designation of a degree awarded. And if you're going to come in to say, well, Matt, what about someone who has a doctorate? Yes, you can call them that. Yes, you can call them that. Okay. And also, again, you have the choice if you want to use the designation of doctor. You can utilize it if you want to. And I see that this comes up at times that people get into this and I feel like they get a little pretentious about this. People, I don't feel like it. It's kind of like they're all high and mighty. And this is something I feel like as people kind of get into something, like the more and more I go along into it, the more I can get these like really out there opinions of stuff. And I feel like, oh, okay, I can have this opinion and all that. I think it's silly that we call ourselves doctor, even though that person may have a doctor. I feel it's silly. That is 100% your choice. If you want to be doctor whatever, that is your choice. If you decide, no, I don't want to be, referenced as doctor, that is your choice. It is totally 100% up to you over it. And I'm going to say, I do not believe anyone has ever changed their mind based on what somebody on social media said. And I'm talking like one time that somebody on social media went, well, you don't call yourself doctor if you have a doctor of physical therapy. And the person went, oh my gosh. Oh, they're right. I shouldn't. No. If you're going to change your mind, it happens over time with gathering information. It's something that you make the decision within. And kind of wrapping this up, I know I'm rambling. I know I'm going on about this. But let me ask, does the public really care? Do they honestly care if we call ourselves doctor or not? Honestly, I really feel like that they don't. And that if they looked on the outside, they kind of look like, why are they arguing about this? They'd probably be like this. So physical therapists have no right or any way, they don't have the educational level, the experience level, or anything to be called doctor in any way, shape, or form. What a weirdo. Whatever. Did you see that? It kind of looks it's dumb to them. I cannot tell you the number of patients. Now, I don't have a doctorate. You're probably going over. I don't have a doctorate in physical therapy. I'm one of the few that's fairly young, and I'm in my 40s, yeah. Let's say I'm young, fairly young, who have a master's in physical therapy. So I don't have the designation of doctor. Have I had patients call me doctor? Yes. Have I had physicians reference me as doctor? Yes. Have students and other PTs call me doctor? Yes. Yes, I have. But I will say there are times when I correct people and times that I don't. If I have any other PT or a student ever call me Dr. Matt, I tell them, like, no, I don't have a doctorate. You don't have to call me that. Patients. I'm going to be honest, straight up with patients, it's often too difficult for them to fully understand the differences to really say like, oh, yeah, I can call this person doctor or not. I've had someone calls them on the phone. Hey, I'm at the doctor's office. Hey, I'm talking to the doctor. They call me doc. Hey, doc, doc, yeah, doc, yeah. Do you think they really care enough to be like, no, it's not this kind of... Are they going to understand what the difference between like a clinical and educational doctorate and what the doctor of physical therapy is versus an MD? Do you think they really are going to absorb all of that and go like, oh my gosh, this just opens my eyes to everything? They don't. And I'm going to be honest. They call like almost everybody, and I've seen it. They call almost everybody that comes in to talk to them doctor. In some form or fashion, they reference, and again, and also they reference people the wrong way, and I have seen that. women I have worked with or been with the hospital that they are the physician. They're a specialist, and they call them a nurse. And I'm like, no. And I'm always quick to be like, no, that's Dr. So-and-so. But they don't know. Even if people come in, again, there's a lot of stuff that goes on with the public of their perception and their understanding. And is it really worth trying to correct it? Do you think they're going to really work? So anyway, in wrapping all this up, it's the dumbest thing. We can deal. There are such bigger things out there to deal with. Bigger things. Getting more people access to rehabilitative services. So that's what it's lowering the barrier. So either lowering the things like copay, the cost of healthcare, the access, putting us in places where more people can access, direct access. There are bigger and better things that we can really spend our energy on rather than sitting and nitpicking. Should you be called Dr. PT, whatever, versus no, you don't use that. And again, if you want to have the argument, okay, cool, go talk to the tree out there. The tree will probably agree with you, and they probably won't talk back. But again, keep in mind, nobody's going to change your mind. That is whatever your opinion. You can have your opinion. I have my opinion about it. If you want to be called doctor and you have a doctorate, cool. If you have a doctorate and you say, yeah, I'm Dr. So-and-so, I will reference that because it's being respectful to you. And if you just say, no, call me Bob, call me Sue, call me whatever, hey, I'm going to go with that. It's just a sign of respect. And again, it was something to probably think about as you go out. So we make fun of the therapists that talk about, oh, you reference yourself as doctor. You're really not doctor. What would you say if somebody was an MD and they made you always refer to them as doctor? And I'm talking about even in casual settings. I have kids. What if I go meet one of my child's parents, friend's parents, and they're like, no, I'm doctor. You refer to me as doctor, and you have to. Do you have to do that in all aspects? And this person gets really belligerent and angry if you don't refer to them as doctor? Isn't that kind of like the other side of it? Like, okay, whatever. Like I said, it's there. If you want to call yourself doctor and you have the doctorate, it's the designation of the degree that you have. Call yourself doctor. Who cares? If other people just get whatever, hit them with that thumbs up. Say, cool. And go about your life because it's not going to change it. Anyway, if you enjoyed the video, hit that like button, please. It helps out so much. Consider subscribing to the channel and let me know your thoughts, opinions, beliefs, or whatnot. Let me know down in the comments below. So with that being said, take care of yourself. Take care of your patients. I'll see you next time.